COVID cases and deaths have been trending steadily down across most of the country in recent days, but the head of the CDC is once again warning against relaxing restrictions.
Now is the time to not let up our guard. Now is the time to double down.
Her main concern, fast-spreading variants of the virus, including one that originated in the UK, which we've long known was more contagious, but are now learning may be more deadly, too. Scientists have also found another concerning strain in the UK that they say appears similar to the South African variant, which has shown some vaccine resistance. Researchers are also keeping an eye on 7 different variants that originated here in the U.S., which they say are mutating in similar ways. And all of it is highlighting the need to get shots in arms as quickly as possible. To that end, the Biden administration announced today it's expanding the number of doses it's sending out to states to 13.5 million this week, up from 11 million last week. But when it comes to the rollout in Massachusetts, some state lawmakers are arguing speed isn't the only issue. 21 legislators sent Governor Charlie Baker a letter last week urging him to stop the companion program that lets anyone accompanying someone age 75 or older to a mass vaccination site to get their own shot, too. The lawmakers argue the policy will put thousands of healthy adults ahead of those who have the most significant risk of getting and dying from COVID-19. I'm joined now by 2 of them, State Representative Tami Gouveia from Acton, who wrote the letter, and State Representative Tram Nguyen from Andover. Representatives, it's good to see you both. Thanks for being here.
Good to see you. Thanks for having me. Pleasure to be here.
Representative Gouveia, can I start with you? You're not alone, obviously, in criticism of this buddy system. Has the governor's office responded to you all yet or no?
No, not directly to me. I know they released a statement sort of doubling down on the buddy system and claiming that they have the support of senior organizations, but haven't heard from his office directly.
Staying with you, though, but first of all, I have the same concerns about it. I have no expertise. I know you have a public health degree. I have the same concerns you do. However, if the governor is going to primarily use mass vaccination sites, what's the alternative for an 80-year-old that doesn't have an adult child to drive them, doesn't have a neighbor? The only way they're going to get there is if a buddy, so to speak, does it. That's true, isn't it?
It would be true if that were the only factors that were driving why our seniors are hesitant to go to mass vaccination sites. I was just on the phone before this segment with a local select board member in the state, and what they told me is that their Council on Aging reached out to 200 seniors. Half of them had already gotten the vaccine, and the other 98, out of the 98 of them, only 6 of them were willing to go to Gillette to go get the vaccine. So there's a lot more factors that need to be accounted for, and it's not just about transportation and getting a ride. Seniors want to go locally. They want to go to a place where they trust their physician or trust the person who's putting the shot in their arm.
Yeah, that may be. I checked the state's website, VaxFinder, at 3 o'clock this afternoon. There were 2,900 appointments available in the next 4 days at Gillette, which to me is scandalous. Representative Nguyen, in your letter, your joint letter, you talk about local public health entities being the best recipient and deliverer of the vaccine. So if it's as obvious to you as it appears to be, why aren't they being used? It's closer to the individual, obviously less scary to the individual. Why are they being utilized in such a limited kind of way?
I think this is our biggest critique of this approach, is that the state is overly relying on these private for-profit entities rather than our local boards of health and even our Council on Aging. And we would like to know the answer to that. And we have I'm actually touring the clinic in Andover tomorrow, and then we have another meeting with the Tewksbury Board of Health on Thursday. The message is clear. They want enough vaccines. They want enough vaccines to vaccinate the seniors because they know these families intimately. And, I'm not even entirely against the buddy system. It's the reality of it is the buddy system at these mass vaccination sites, they have no safeguards. Mm-hmm. These people don't know who the buddies are, which actually leaves our seniors much more vulnerable. Whereas, for example, the Andover Senior Center, they know who the seniors are. They know who takes care of them and who should be going with them and bringing them to these sites to get the vaccines in them as soon as possible. And I think these are the biggest concerns for us.
You know, but the audience may not know, you too also co-signed another letter, this one to Mary Lou Sutters, Health and Human Services Secretary, who's running the COVID thing. I'll read you just a part of it. Many of our constituents, particularly those in high-risk demographic categories, are working full-time, unable to get to a vaccination site during regular 9 to 5 business hours, making evening appointments available at least one night a week until 9 p.m., et cetera, et cetera. It seems, I mean, talk about a no-brainer. I hate that term, but talk about a no-brainer. One night a week doing this. And when I read these two letters today, Representative Gouveia, it seems to me that the legislature is almost like swatting at flies. At the beginning of the vaccine rollout, the first interview your new speaker did with WCVB, he's on the vaccine advisory board, and he's asked, how's the vaccine rollout going? He says, I have no idea. Today, he says teachers should be moved up the list. Don't you all, and I mean all 200 of you, I don't mean you two alone, don't you need to be asserting yourselves more strongly if you believe that the governor, though well-intended, and you acknowledge that, of course, is going in the wrong direction?
Absolutely. I think the problem with that is that under the state of the emergency, the governor does have the authority to act, and that's with good intention so that we can move swiftly and quickly. I think the problem is that the path that he's chosen to circumvent local public health infrastructure and expertise and rely on for-profit entities to weigh in both on the reopening advisory committee, the role that they've had there and the influence that they've had here, as well as with the vaccine rollout. So I think it's time for the governor and the Baker-Polito administration to really pump the brakes, go back to the drawing board, and really revisit making sure that it's a human-centered, patient-centered approach, not this making it really super easy and efficient for large conglomerates to be able to put shots in people's arms.
Representative Nguyen, I understand. I'm sorry, go ahead.
I want to add briefly to that. I think that the statement from the speaker seems to be out of context. I think what he's referring to is our constant frustration since the beginning of the pandemic is that the administration holds everything very closely to the chest. And what we want to know, we want to know the information beforehand. It's not that we have no idea. It's that we're not getting the information that we need in order to answer to our constituents as they come to us with these issues. And I think true leadership is to be able to admit a mistake and take action to correct it. And I think that the companion program as it's being rolled out is a big mistake.
Well, Representative Nguyen, answer one more question for me if you can. I understand the emergency power thing that Representative Gouveia is saying, but 10 of the 11 members of Congress urged the governor to put in place a centralized pre-registration system, which places like a poor state like West Virginia have. Explain to me, would you not have the power to pass such a thing? And even with the governor's emergency? Yes? So why don't you do it?
There is actually a pending bill to address this very issue with the centralized registration system, and we are looking at ways to do that.
Okay, before you go, you mentioned, starting with you, Representative Nguyen, then quickly Representative Gouveia, you mentioned your constituents, and what do you say? I pulled out 3 emails that I got today on the radio show from a scared 72-year-old, a person with cancer, and a 76-year-old with no family to take them to a mass site. Very quickly, Representative Nguyen, starting with you, if those 3 people were your constituents, what would you say to them?
Well, right now we are doing everything that we can to make sure that the administration actually gives our local departments the vaccines that they need so that they can really implement their clinics. And the important thing is to make sure that we get regularly scheduled vaccines so that the clinics can better plan for future appointments. And so whatever the state is not doing, our local communities can and they will. And so my emphasis is to make sure that our local communities are getting the vaccines and that the vaccines are not being diverted to the mass vaccination sites, which, I mean, the companion program really pushes down people who are 65 plus, people with comorbidities, as well as
essential workers, obviously.
Absolutely.
So, Representative Gouveia, I'm very short on time. What do you tell those constituents?
I literally sit on the phone with them and look at the website and try to help them navigate it. I've been looking at what's coming up in terms of CVS and Walgreens because those are more local. And also I've been in very regular touch with my municipal leaders, my health board leaders, health department leaders, and also the senior centers, because those are often the places where, you know, for that person who's 76-year-old who needs a ride, we can try to do some coordination. But it shouldn't have come to this. Like, the legislature shouldn't have to step in and do this kind of casework. This really should have been done at the local level where there's already the expertise and the capacity to put shots in people's arms. They just need the vaccine going out to our locals rather than to these mass vaccination sites. So that's really the message here.
Representative Gouveia, Representative Nguyen, thanks for your time and thanks for your work. I really appreciate it.
Thanks for having us.
Thank you so much. Take care and be well.